Hello, I'm Max. This news report has been collected using advanced AI technologies, and while we strive for accuracy, some information may not be fully up to date. We start in the United Kingdom, where reports are emerging about the long-term impacts of the 2012 Health and Social Care Act on the National Health Service. A significant report by Prof. Ara Darzi, commissioned by Health Secretary Wes Streeting, claims that past health policies have left the NHS vulnerable, particularly evident during the COVID-19 pandemic. Notable reductions in routine healthcare services, such as a 68% decrease in hip and knee operations, have placed the UK at a disadvantage compared to other countries. Prime Minister Keir Starmer has emphasized the need for comprehensive reform, while the Conservative Party defends the NHS's achievements and the impartiality of previous reforms. Across the Atlantic in the United States, there are growing concerns over the management of the H5N1 bird flu virus, drawing parallels to past handling of the COVID-19 pandemic. Experts warn that political and systemic issues might hinder effective responses. Although the current threat level remains low, experts urge vigilance to prevent severe outcomes. The H5N1 avian flu's global impact is notable, with over 280 million birds lost since 2021, affecting wildlife and agriculture worldwide. Mass die-offs in mammals and heightened concerns about biodiversity are observed as the virus has spread to all continents except Oceania. While human cases remain rare, with 14 reported in the US this year, the potential for high mortality rates demands continued attention. In California, the bird flu has unexpectedly affected dairy cattle, believed to be caused by interstate cattle transfers rather than traditional wild bird transmission routes. The development has led to stricter biosecurity measures on U.S. farms, with affected herds placed under quarantine to protect California's milk supply. Researchers at the National Animal Disease Center in Iowa are working on a vaccine to prevent broader health risks as they explore the virus's genetic adaptations. A recent case in Missouri highlights a unique facet of the H5N1 situation, with the virus detected in a human without direct animal contact. This case, identified through national flu surveillance, has triggered a reassessment of CDC guidelines. The individual, who had underlying health conditions, was hospitalized and has since recovered with no further spread noted. This singular case joins the 14 human cases identified in the U.S. this year, sparking further analysis of virus transmission and its links to animal outbreaks. Nationwide, the avian flu has affected numerous dairy herds and various animal species across 14 states, although Missouri has primarily seen its poultry industry impacted. Epidemiologist Caitlin Jetelina has pointed out inadequacies in testing protocols for humans, cattle, and raw milk, underscoring the need for improved detection measures. While the CDC considers the public risk low, it continues monitoring flu samples extensively and advises caution to avoid sick animals and consume only pasteurized milk. That's all for today's news. Thank you for listening. Stay informed and stay safe.